Dr. Jash Ajmera, psychiatrist practicing in Surat, Gujarat. So today we'll be talking about Alzheimer's and dementia. So let us know what is Alzheimer's and dementia. Dementia is a broad term used for progressive cognitive decline which are severe enough that interfere with our daily activities. And Alzheimer's is one of the main cause of it, which accounts for about 60 to 80% of the cases. It is good to note that dementia is not just the part of a normal aging process in which many people lose certain memory at certain age, but this is a progressive cognitive decline with memory, reasoning, and other cognitive abilities. And how can we spot early signs of dementia or Alzheimer's? So there are memory loss. The patient suffering might forget where they have kept certain things, like they will be have difficulty managing their bills, right? And there is difficulty in planning and problem solving, like managing their bills or following recipes. There is challenge with familiar tasks, like they will forget the way they used to drive every day. They feel they might get lost. And another is confusion about time and place. They lose track of the seasons, or they might get confused of where they are about their whereabouts. There are mood and personality changes, right? They include unusual anxiety, suspicions, or aggression, or even withdrawal from the society. Then there is poor judgment, like neglecting their own hygiene, or their overspending it, or mishandling their finances as such. So, if at all someone notices certain changes, it is advisable to consult an healthcare professional like psychiatrist immediately. So, what can be done to prevent dementia? Like, so not all the cases of dementia can be prevented, but research shows that lifestyle changes can reduce the risk of it. First is like staying mentally active, like engaging in puzzles, reading, or learning new skills to strengthen cognitive reserve. Second is to exercise regularly. This improves your blood flow to the brain and lowering the risk of cognitive decline. Third is adopt a healthy diet. Healthy diet which includes fruits, vegetables, whole grains, and a healthy fats. Right? Then control other physical comorbidities like your blood pressure, diabetes, which can increase the risk of dementia. Sleep is a very important factor. To prioritize and aim to sleep at least 7 to 9 hours a day to prevent brain damage linked to sleep deprivation. So, and last one is staying socially connected. Meaningful relationship with friends, families, and at your workplace or in your neighborhood reduce stress and keep the brain stimulated. And lastly, avoid tobacco and limit alcohol use, which are linked to brain health. So, after consulting a psychiatrist, what can you expect, or what are the ways to manage or slow the progression of dementia? So, number one is medications. There are certain medications, out of which commonly used medications are cholinesterase inhibitors like donepezil, which in generally improve communication between the brain cells. Second is NMDA receptor antagonists like memantine, which regulate brain chemicals to enhance cognition. Second is behavioral symptoms. For behavioral symptoms, like we use antidepressants or antipsychotics depending on the symptoms like mood swings, aggression, or hallucinations. Third are therapies like cognitive stimulation therapies, which improve memory by problem solving, or reminiscence therapy to evoke positive emotions and positive memories. Non medical interventions, there are music or art therapy or structured routine, even can help improve mood and reduce anxiety. And lastly, lifestyle adjustments. So, encourage light exercise, proper nutrition, and a calm or less distracting environment for the patients. And last, what are the tips for the caregivers, how they can help the patient who are diagnosed with dementia? Number one is create a safe environment. Remove hazards like slippery mats or rugs, and and also install labels so that to help them navigate. Second is establish a routine. Consistency reduces confusion. and provides stability. Third is communicate effectively, use simple, clear language, and be patient. Fourth is engage in meaningful activities like individuals' abilities and like listening to music or light gardening or even assisting in household chores. And fifth and most important, take care of yourself. Caregiver burnout is very common. So, if needed be, prioritize your mental health and your physical health. And lastly, to conclude, dementia is a very complex condition, and early intervention, lifestyle adjustment, and compassionate care, we can provide individuals suffering with dementia a better quality of life. Thank you.